Thank you very much, Natalia. I'm delighted to be here this afternoon. My talk will move into a slightly different space than we have before, but it focuses very much in the first 1,000 days, and we'll talk about what's called the Nurturing Care Framework. Okay, if we look at early child development, early development is thought of from conception through age 8 years. So the first 1,000 days, as we know, represents from preconception up through age 2. And the second 1,000 days then extends from age 2 to age 5. And so during that time, there's tremendous growth that happens in young children as they go from basically being unable to move very much to being able to run and play. During that same time, there's also tremendous development that we see in children as they learn to talk and to read and to do all kinds of things very early in life. So there's tremendous growth and development that occurs. When we think about development, we think about a life course perspective. So what that means, and as we think about it in the first 1,000 days, is that we help children get off to a healthy start, and that by having this healthy time, having this healthy period very early in life, that they're on a trajectory that continues throughout life into adulthood with healthy development where they're well prepared for school and for economic productivity and into the next generation. So those are the goals, and there's evidence that if it starts well early in life, it can proceed. But all too often, it doesn't start so well. And what happens is that the disparities that occur very early in life, within the first 1,000 days, let's see if I can do this, here, then increase and continue to increase so that by the time you get to adulthood, you're at increased risk for chronic health problems and increased risk for not meeting your economic potential. And then it continues into the next generation, and this is illustrating the increased risk for having a child who is stunted and into another pattern. So the risk of not reaching one's developmental potential early in life is enormous. So the challenge then is, what can we do? And the green line represents the green trajectory represents an attempt to move that red trajectory up closer to the ideal so that we eliminate some of the chronic illnesses and have better capacity throughout. And we hope then that the next generation is well prepared to move forward. So this life course perspective is not just theoretical, but it's been demonstrated from multiple perspectives, from a biological perspective, from an economic perspective, from a psychological perspective, from an epigenetic perspective. So it has, in fact, been demonstrated by very strong evidence. So what we see is the way that it works, and as you've heard, that the parent's health and well-being prior to pregnancy then increases the odds that the pregnancy goes well and we move on. But there are epigenetic changes that can occur throughout. So those are experiences that individuals have that can either promote or disrupt the development of the mother and then of the child. So what we look at would be the timing and the context of either the positive or the negative experiences that shape children's potential and then ultimately influence their health and growth and learning capacity and behavior and emotions. This is a slide that represents early brain development. And if we look at this, I've drawn a box around the first 1,000 days. So the first thing you notice is that the brain development begins at conception. So prior to birth, there's already much that's going on, and we can see early myelination and the early visual and auditory cortex. And then if we continue up through age 2, you can see the development of receptive and expressive language and the synaptogenesis that goes on and extends up through life. And so one of the things, somehow I managed to work this slide into many of the presentations that I give, and I often ask people who are in the audience to find themselves on this slide. So if you find your age along the x-axis, you can see what is going on in your brain at this time. Well, that would be not much. And basically, we're attempting to hold things together. The other thing that happens is we emphasize synaptogenesis, but the part that is here that we haven't emphasized so much is the pruning process that takes place. So pruning operates from a simplistic perspective on a use it or lose it phenomenon. And the most obvious example of that is early language development. So that if you are exposed to languages that have different sounds, different phonemes, you will retain those. If you are not exposed, you will not retain them, and it will be more difficult to acquire them later on. So we say that if you're interested in investing in long-term brain development, what timing, when would you invest? Pretty obvious. That because these things that occur are exquisitely timed. The development of the visual and auditory cortex does not happen among 3-year-olds. It happens during those first 1,000 days. So that's another reason why we're focusing on this today, and to see what can we do to promote early development during this period. Well, moving on, if we look at what are some of the long-term consequences of early nutritional deficiency, for example. This is a study done by Patricia East and Betsy Lozoff using some of Betsy's long-term data from Chile. And when they look at children who are iron sufficient versus iron deficient, and then iron sufficient versus iron deficient anemia, and so on. And so when this is an observational study, and when they follow the children over time, by 5, children who were anemic early on are more likely to have a dull affect. Their mothers are not so responsive, and as they follow them over time at age 10, they experience some peer rejection, and then in adolescence, there's some deviant friends and problem behaviors. It's not a very pretty picture. So what it suggests is this is putting the trajectory that we looked at into providing some data that support that trajectory, is that once you get off, then it's hard to get back on, and there's an accumulation of negative things that occur, and in this case, resulting in problem behavior and deviant peers. So again, more evidence that we try not to get on that trajectory in the first place. When we think about the NCDs, or the non-communicable diseases, these are the non-infectious, non-transmittable diseases that are chronic and long-term and develop slowly. So what we've seen is that there's a particular burden of these diseases that have been increasing in low and middle income countries, and certainly we see them in low income communities. In the city where I live in Baltimore, we have a 20-year disparity in mortality. So in the neighborhoods outside my window, it's 20 years lower than in the neighborhoods where I live, which are not far apart. And it's due not only to people shooting one another, which happens, but it's due to these chronic illnesses. So there are behavioral risk factors that certainly increase that in adulthood, like tobacco use and unhealthy diet and physical activity and alcohol use, but many of them start with patterns in early childhood. And this just illustrates the mortality that happens in these NCDs. Of the mortality, the largest is related to cardiovascular diseases. So the consequences of having poor health early in life are certainly quite dire. What are some of the risks, or what influences this life course perspective? We talked a bit about the epigenetic changes, and we think that those can begin to happen prior to conception. So this, again, shows us some of the processes that influence development throughout life, and low birth weight, and also rapid weight gain. The combination of those two prior to age 2 increases the risk. So we focus on how to build healthy habits in life. As we've talked about, nutrition has a critical role in this, in processes such as breastfeeding, having a healthy diet, along with physical activity. And in the early learning, we've not talked about so much, but you've heard about responsive feeding and some responsive caregiving in the most recent talk. So what happened is there is a series of papers in The Lancet published in January of 2017 that reviewed what children need in terms of their early development during this first 1,000 days. And the consensus was that what they need is what's called nurturing care. Nurturing care is defined by 5 domains. So those domains are nutrition, health, responsive caregiving, illustrated by responsive feeding, security and safety. That means protection from danger. So that can be protection from toxins, protection from violence. It's a broad definition of protection. And they need early learning, opportunities to explore and learn and discover. So as the figure illustrates, those domains are indivisible, meaning that one can influence the other if something goes awry. So for example, if the nutrition goes awry, as I showed you in the slide from Patricia East and Betsy Lozoff, then it impacts other areas. So that each one of these domains is necessary, but no single domain is sufficient. So it means that children need attention to all of them, to nutrition, to health, to early learning, to responsive caregiving, and to security and safety. So the challenge is how to make that happen, and that's what we'll talk about. This is what it says: no single component is sufficient. Each one is necessary. From a global perspective, the United Nations has adopted what are called the Sustainable Development Goals. These are aspirational goals to be completed by, or made headway by, 2030. And they focus on human rights, in ensuring healthy lives and well-being for all of us at all ages and into the next generation, that they're integrated goals and that they address the economics, the social, the environmental. That includes the global aspects of warming and climate change. So countries are held accountable to these sustainable development goals. So if we look at them, there are 17 goals, and they include such things as reduction of poverty and reduction of hunger and good health and well-being, and so on. Then within these 17 goals, there are 169 targets. So goals will have varying targets. The one that the early child development people focus on very much is goal number 4, which has to do with quality education. And one of the goals is that children will have access to primary school and they will have access to education prior to primary school. And as you can see, goal number 3, which is good health and well-being, and number 2, zero hunger, they're very aligned with nutrition goals as well. And they go on to clean water and sanitation and so on. So what we say is that if you look, and I'm sorry, I forgot to mention, in the center of those goals, in the center of that diagram is where you see nurturing care. So the plan is that by ensuring that children are well-nourished and developing well in the beginning, then we have better chance of being able to reach these sustainable goals and better chance that our societies will move forward. So the goals are not only for individual children and families, but for our society as a whole. So where are we now? How are we doing? Well, the answer would be not great. In the Lancet series, we used indicators to look at how many children are and or not reaching their developmental potential, and the estimate is that 249 million children under age 5, or approximately 43% of children under age 5, are not reaching their developmental potential. And those are using indicators of stunting, which is a marker of chronic undernutrition, and of abject poverty. So the risk then of this many children not reaching their developmental potential is increased risk for non-communicable diseases, poor academic performance, and low human capital. So it's a fairly dismal picture unless we sort out what it will take to be able to move forward. So if we think about what a nurturing care framework would be, or how we move forward, and how nutrition education can fit into that, then this is a model developed by Bronfenbrenner in the 70s that has guided much of our thinking about early development. So the way that it works is you see children who are embedded within a family. And as many of the talks have emphasized today, whether we're thinking about what children eat or how children eat, it's very largely influenced by their family. On the other hand, what happens is that children also influence how their families behave toward them, and also influence to some aspect what their families are feeding them. So thinking about how to help kids develop their developmental potential, we do that within families. And where that leads us is to think about providing an enabling environment for families to enable them to look after their children, whether that's ensuring that they're not food insecure so that they have enough food, or they have opportunities for early education, or they have parental leave, so that mothers can breastfeed their children. There are a whole host of things that support a family that will enable our children to reach a developmental potential and to do well. So carrying it further, the ecological model would say that we provide the communities and services that support families, and those are guided by policies. And that's where the Sustainable Development Goals come, because they are meant then to influence policies and programs within countries that will ultimately benefit children. So how does that happen? Well, it happens by having a broad reach, so reaching those who are least able to manage on their own, and by having programs and policies that are sustainable, meaning that they continue and they can grow, rather than a program here and a program there. So if we think about how we can do that, and how we meet the needs of children and families, from a broad perspective on the bottom, if we think about a population coverage, then we want to be able to reach all children and caregivers to some extent. But then we have families and children who are particularly at some risk. Often this is a risk that is defined perhaps by an environmental risk, meaning that they're living in an area where there is limited access to food, and so children within that community tend to be undernourished or tend to be stunted. So it's a regional or community risk. And then we have at the very top, these are children who may be disabled or have very specific or additional risks. So how do we manage what we do? Well, if we think from an equity perspective, then we have an inverted triangle. So for those who are, for reaching all caregivers here, then there's a universal support or universal programs that are available. And that as the need increases, then the targeted aspect of the support goes. From a U.S. example, this would be the WIC program. So the WIC program is, as you heard, available. Approximately 53% of the infants in the U.S. access the WIC program. So the eligibility is a financial eligibility and a nutritional risk. So it's not available for everyone, but it's available for those in a community who would have some vulnerability. And then for the top, those families who have additional needs, then it's a heavier support that would go to those families. And that may be specialized services such as a clinic for a child who is failing to thrive or who is not doing well. So we think about how to manage the services so that we have some equity in this, but we're able to reach a population. So those are some of the thoughts in how you would move forward with families. One of the things, I think probably most of us here, many of us here, were trained as either clinicians or in a specific discipline. And we think that as we learn, if we want to disseminate what we have learned, how do we do that? Well, we can disseminate things by publishing a nice paper. And so many of us have published a nice paper. Well, how many have actually read the paper or put the paper into action? That would be not so many. So then we say, well, okay, I will be publishing it on a website, so I make it more accessible. better, slightly better, but not good enough. So how can we actually take what we have learned and have a research to practice model? What would we do? There's another science. There's a whole other science for doing this called implementation science. Most people, myself included, have not been trained in implementation science. But we then realize that it exists, and there are people who have been trained in doing this. So this is a bit about implementation science. It's the study of how to promote evidence-based practices that we do know about, such as nutrition education, with the goal of improving services, and then ultimately what we care about is improving child outcome. So how do we do this? Well, it's complicated because we have these 5 domains at least, so you need multi-sectors and you need multi-levels to be able to do this. And that we want to be able to reach the most vulnerable, not just those who were managing anyway, but those who were the most vulnerable. And we want to be able to make sure that we do it with fidelity, so that if we have an evidence-based practice, that's what's put into place. And we need metrics. We need metrics, because how do we know whether it's working or not working? So we need a way to keep account of it. And then we need to be able to course correct, because we probably won't get it right the first time. So we need a way to do quality improvement in what we're going about. And then we need to be able to scale it and we need to be able to make it sustainable. So these are some of the things that implementation science folks care about. They already assume that it's evidence-based because that's where we're starting. So one of the ways of doing this is a framework applied to nurturing care that incorporates the metrics. So that's being able to measure what you've done. It incorporates evaluation, so you can determine whether you've made progress. There's research, have you met the goals or your targets? You learn what works, and then you course correct. So this is put together in something that is called MERLA, or including monitoring, evaluation, research, learning, and adaptation. There are these frameworks within implementation science. So this is one that I mentioned as an illustration of how this works. So you start with an intervention such as nutrition education, and then you have the mechanisms in place to be able to monitor who's receiving it and to evaluate, is there a theory of change? Is there a logic framework? Are there indicators? How are they working? Are you moving forward? And if so, how do you continue or reach further? And if not, how do you adapt? So then what happens is this is the continuous quality improvement in terms of working back up to the intervention to modify that and to continue to progress. So this is again, this is an illustration that has been somewhat new to me, and so we've been involved with taking nurturing care and then applying it in an implementation science perspective. So there are little diagrams that illustrate how one would do this, but it's very much bound up in the metrics aspect, in the data collection. It's not fancy statistics. It's basically monitoring the indicators, so ensuring that the indicators are there so you can see how far up that triangle your one is going. So, for example, starting in this, you would establish a learning agenda. What are the objectives and the goals? And then you implement that agenda, and then you you look at from the monitoring and evaluation research how it's going, and then you adapt. So the adapting part is what's really critical, because then you go up and modify what it is you're doing. So it's a continuous framework. This is just another illustration of how the integration of how these pieces are tied together. It also involves, when you think about the nutrition education and where it happens, it's often very much of a public-private partnership. Because much of the nutrition education, just as the early child development, takes place in developing or in low and middle income countries, often takes place through non-governmental institutions. But when we're thinking about doing this, you try to tie those together with government institutions. Because if you're interested in the reach and sustainability, you often need the government institutions as part of this. So when we think about how the equity requires support, and that it starts during the first 1,000 days, but it doesn't end there. So as we started, we talked about we can ensure that during the first 1,000 days that children are reaching their developmental potential by focusing on that time period. But it doesn't mean they're home free. So it's a plea to say that as we move forward, we think about the second 1,000 days and even the third 1,000 days, and up through adolescence. But is that not the continuum that we have been talking about in terms of being sure that we're ready for pregnancy? So that we have then this life course perspective where we're moving back up onto the ideal perspective, or this blue perspective, so that it requires thinking about a nurturing care framework that goes through the life course. So the first 1,000 days is just a place to start, but the plea is it's not a place to stop. Thank you.